Cosmetologist and Esthetician Written Study Guide number 4 regarding skin disorders and diseases. Please read your textbook for more information on each subject. Information is not limited to the one shown in this video. Be sure to please look for your state's reference list regarding your written examination. Identify disorders and diseases of the skin. Lesions of the skin. A lesion is a mark on the skin that may indicate an injury or damage that changes the structure of tissues or organs. Primary lesions of the skin. Primary lesions are lesions that are different in color other than the color of the skin and lesions that are raised above the surface of the skin. They're often differentiated by size in layers of the skin affected. These may require medical referral. We have number 1, a bulla. A bulla is a blister containing a watery fluid, liquid, similar to a vesicle but larger. It requires medical referral. Number 2, cyst. A cyst is a closed, abnormally developed sac containing fluid, pus, semi-fluid above or below the skin. It requires medical referral. Number 3, a macule. A macule is a flat spot or discoloration on the skin. Number 4, nodule. A nodule is a solid bump larger than 1 centimeter that can be easily felt. Number 5, papule. A papule is a small elevation on the skin that contains no fluid but may develop pus. Number 6, pustule. A pustule is a raised, inflamed papule with a white or yellow center containing pus in the top of the lesion. Number 7, tumor. A tumor is an abnormal mass varying in size, shape, and color. Any type of abnormal mass, not always cancer, requires medical referral. Number 8, vesicle. A vesicle is a small blister or sac containing clear fluid lying within or just beneath the epidermis. Number 9, wheal. A wheal is an itchy, swollen lesion that can be caused by a blow, scratch, bite of an insect, skin allergy. Secondary skin lesions. Secondary skin lesions are characterized by piles of material on the skin surface, such as a crust or a scab, or by depressions in the skin surface, such as an ulcer. Number 1, crust. A crust is dead skin cells that form over a wound or blemish while healing. Accumulation of sebum and pus, sometimes mixed with epidermal cells. Number 2, excoriation. Excoriation is a skin sore or abrasion produced by scratching or scraping. Number 3, fissure. A fissure is a crack in the skin penetrating into the dermis. Number 4, keloid. A keloid is a thick scar resulting from excessive growth of fibrous tissue. Number 5, scale. A scale is a thin, dry, or oily plate of epidermal flakes, excessive dandruff. Number 6, scar. A scar is a slightly raised mark on the skin formed after an injury or lesion of the skin has healed. Number 7, ulcer. An ulcer is an open lesion on the skin or mucous membrane of the body, followed by loss of skin depth and possibly weeping a fluid or pus. Requires medical referral. Identify disorders of the sebaceous glands. Oil glands. Number 1, open comedo, also known as a blackhead, is a hair follicle filled with keratin and sebum. Comedones appear most frequently on the face, especially in the T-zone. When the sebum of the comedone is exposed to air, it oxidizes and turns black. Number 2, closed comedo. When the follicle is closed and not exposed to the environment, the sebum remains a white or cream colored and appears as a small bump just under the surface of the skin, also known as a white head. Number 3. Milia. Milia are benign keratin-filled cysts that appear just under the epidermis and have no visible openings. They resemble small round sesame seeds. Number 4. Acne is a skin disorder characterized by chronic inflammation of the sebaceous glands from retained secretions and bacteria known as Propionibacterium acnes, P. acne, the scientific term for acne bacteria. Number 5. Sebaceous cyst is a large protruding pocket-like lesion filled with sebum. Sebaceous cysts are frequently seen on the scalp and the back and may be surgically removed by a dermatologist. Number 6. Seborrheic dermatitis is a skin condition caused by an inflammation of the sebaceous glands, often characterized by inflammation, dry or oily scaling, or crusting and or itchiness. Number 7. Rosacea is a chronic condition that appears on the cheeks and nose, characterized by redness, telangiectasia, which is dilation of the blood vessels, and formation of papules and pustules. Factors that aggravate rosacea are spicy foods, caffeine, alcohol, exposure to extreme temperatures, sunlight, and stress. Identify disorders of the sudoriferous glands, also known as sweat glands. Number 1. Anhidrosis is a deficiency in perspiration or the inability to sweat, often a result of damage to autonomic nerves. This condition can be life-threatening and requires medical attention. Number 2. Bromhidrosis is a foul-smelling perspiration, usually noticeable in the underarm or on the feet, that is generally caused by bacteria. Number 3. Hyperhidrosis is excessive sweating caused by heat or general body weakness. Number 4. Malaria rubra, also known as prickly heat. It is an acute inflammatory disorder characterized by an eruption of small red vesicles and followed by burning and itching, caused by exposure to excessive heat. Recognize inflammations and common infections of the skin. Number 1. Conjunctivitis, also known as pink eye, is a common bacterial infection of the eyes. It is extremely contagious and should be referred to a physician. Number 2. Dermatitis is a term broadly used to describe any inflammatory condition of the skin. Number 3. Eczema is an inflammatory, uncomfortable, and often chronic disease of the skin, characterized by moderate to severe inflammation, scaling, and sometimes severe itching. Number 4. Herpes simplex 1 is a recurring viral infection that often presents as a fever blister or a cold sore. Although many people have no symptoms, it is characterized by the eruption of a single vesicle or group of vesicles on a red swollen base. Number 5. Impetigo. It is a contagious bacterial skin infection characterized by weeping lesions and usually caused by a Staphylococcus bacteria. Impetigo normally occurs on the face, especially around the nasal passages, and it is mostly seen in children, although it is possible at any age. Number 6. Psoriasis is a skin disease characterized by red patches covered with silver-white scales, and it is usually found on the scalp, elbows, knees, and chest and lower back. Psoriasis is caused by skin cells turning over faster than normal, and when the condition is irritated, bleeding points can happen. Psoriasis is not contagious. Recognize pigment disorders of the skin. Number 1. Hyperpigmentation means darker than normal pigmentation in splotches. Number 2. Hypopigmentation is the absence, lack of pigment, lack of color, resulting in light or white splotches. Number 3, albinism is a congenital hypopigmentation or absence of melanin pigment of the body, skin, hair, and eyes. Number 4, chloasma or melasma is a condition characterized by hyperpigmentation, blotchy brownish spots on the skin, mostly caused by hormonal changes and sun exposure. Number 5, lentigines are benign lesions that occur on the sun-exposed areas of the body. The back of the hands and face are common areas. The lesions tend to increase in number with age, making them common among the middle-aged and older population, commonly called liver spots. Number 6, leukoderma is a skin disorder characterized by light, abnormal patches. Hypopigmentation, it is caused by a burn, scar, inflammation, or congenital disease that destroys the pigment-producing cells. Number 7, nevus, also known as a birthmark, is a small or large malformation of the skin due to abnormal pigmentation or dilated capillaries. Number 8, stain is an abnormal brown or red skin patch having a circular or irregular shape. Number 9, tan is a change in pigmentation of the skin caused by exposure to sun or ultraviolet light. Number 10, vitiligo is a hereditary condition that causes hypopigmented spots and splotches on the skin that often appears as milky white. Skin with vitiligo must be protected from sun exposure at all times. List hypertrophies of the skin. A hypertrophy is an abnormal growth of the skin. Many are benign or harmless. Number 1, keratoma or callus is an acquired superficial round thickened patch of skin due to pressure or friction on hands and feet. Number 2, mole is a small brownish spot or blemish on the skin, ranging in color from pale, tan to brown or bluish black. Number 3, a skin tag is a small brown or a flesh-colored outgrowth of the skin, occurs most frequently on the neck, underarm, and chest. Number 4, a verruca, also known as a wart. It is a hypertrophy of the papille and epidermis. It is caused by a virus and it is infectious. Understand skin cancer. Number 1, basal cell carcinoma is the most common and least severe skin cancer, characterized by light or pearly nodules and has a 90% survival rate with early diagnosis and treatment. Number 2, squamous cell carcinoma is more serious than basal cell carcinoma, characterized by scaly red papules or nodules. It can be spread from other parts of the body. Number 3, malignant melanoma. It is the most dangerous form of skin cancer, characterized by black or dark brown patches on the skin that may appear uneven in texture, jagged, or raised. Analyze aging skin issues. Intrinsic factors are skin aging factors over which we have little control. Genetics and ethnicity play a significant role in how our skin will age. Our predisposition to skin disorders and our ability to tolerate sun exposure also play a role. Gravity and constant pulling downward on our skin and bodies is a consistent factor for everyone. Extrinsic factors are primarily environmental factors that contribute to aging and the appearance of aging. Many scientists and dermatologists believe that these extrinsic factors are responsible for up to 85% of skin aging. Sun exposure, smoking, overuse of alcoholic beverages, stress, poor nutrition, and exposure to pollution. UVA rays, also called the aging rays, deep penetrating, weaken the collagen and elastin fibers, causing wrinkling and sagging of tissues. UVB rays, also called the burning rays, cause sunburn and tanning of the skin by affecting the melanocyte cell. These rays are not as deep as UVA, but are equally damaging to the skin and eyes. And that is it for today's video. Thank you so much for watching. If you are new to my channel, welcome. If you found the information helpful, don't forget to share, like, and please consider subscribing. Let me know in the comments down below if you are currently studying for your state board's written examination. I hope you found the information useful and, of course, helpful. Don't forget to keep going, keep growing, and I'll see you guys on the next one. Bye, guys.